what are they needed by us in treating Puberphonia, follow-up, and how to make it awareness throughout the world. But the whole medical world want to have a scientific evidence for it. So we have decided and give all our scientific opinion. We have so far published 9 articles in international ENT journals. Still, ENT surgeons are reluctant to take this subject because they feel this case is not so much. It doesn't require any surgical procedure. That is what our textbook told. Now, our boss, Mr. C.P. Velasamy, chairman of Korea Medical Electronics, will explain, will give the project, but he is a resource officer. So tell me the possibility of extending the procedure to be utilized globally. Kindly tell, sir.
No, actually what you have done already, you have proven it, scientifically published it. Only thing is people are not convinced.
Yes, that's correct.
People are not convinced. It's more than a technical work, it becomes like a communication gap. How to convince people who don't want to get convinced. Right?
Okay.
That is the problem. That's one side of it. No, maybe, if we know, do we have any number about how many people will have this problem in India?
No, it was some 20 years back told 1 in 10,000. But now my feeling is we have done study in 3 colleges. 1,000 people are there, means 3 are there. They need not have a lady voice. Their voice may be low voice, double voice, silent voice. So all the things we are including in the same category.
Okay. Now see, people are looking at a narrow case of ladies' voice only.
Okay.
And that is why for them the number is small, so we don't have to do so much on this. Now we have to convince them, not only we are taking care of people who have female voice, we are taking care of other voice problems.
Okay, sir. Great.
And when we include this, there is a need for it.
Okay.
And if there is a need for it, how we can convince them?
Okay.
We will think about it in detail.
How we go forward is research. You give a roadmap for it. You have to go to the university level and international university level, IIT level, and Anna University level. Then you are able to guide, sir.
We will do that.
What are the methods, sir? What are the things you are expecting from us?
No, once we take it over, discuss with us, within ourselves, we will come back to you. It's not like, I'll give you an example. In 1981, we approached Indira Gandhi saying that we should bring computer to India. I will send you the publication from India. So what she said is, okay, why don't you go and meet the industrialists all over India and explain to them that there is a need for computer, right? So I went first to Coimbatore. All the textile magnets were there. The first thing they said is, you say this program is invincible. கண்ணுக்கு தெரியாது. நான் காசை போட்டால் நூலை பார்க்குறேன், துணியை பார்க்குறேன். இது கண்ணுக்கே தெரியாத பொருள் யார் இன்வெஸ்ட் பண்ணுவேன்? Who will invest? So we face so much problem all over India. From 1981, it came into reality in 1986 budget. 5 years we have to struggle convincing people India needs computer. So this maybe, I don't know what, see, there is no strict formula like this is why we do it. This is a different problem. This may need a different solution. And if it clicks, then you might have tried many of those things like meeting press, talking to the politicians, academicians and all that. Now, first let us get this project, and then there are two things here. First you want to propagate what you have already achieved. Make it accessible to more and more people.
Great, sir.
Second one is the clinical project
Yes.
where you want to go. So
No.
both of them has to be separated.
Okay, sir.
So the first one we will, to do something new. It always takes some kind of different approach. We don't know what it is. Okay, we will find out.
Boss, we know because you had already experienced lot of problems in bringing out the ultrasound. You tell the story how ultrasound was utilized universally now. First it was just a play. I know because you have our contact with the great person, cardiologist, plastic surgeons, eye surgeon, even you are the instrumental for bringing a multi-crore project hospital. See, you are involved with that, but somehow you will get back, I know. Okay, that is different. But what are the sufferings you got? Kindly explain. We'll also try to undergo that. No problem.
No, it's not like much difficult because when we first introduced ultrasound, when I met the DME, I think Dr.M.Kumaresan, and the first thing they said is, if you want clear picture, you get it in X-ray, or we will go for exploratory surgery. What is this intermediate thing? It is useless. Then when we tried to sell it, he said, all over India, maybe for research purposes, India may need about 10 ultrasounds. That is given in writing. Today each street has 10 ultrasound. Then our good friend here,
Ramesh.
Suresh, he was the first one to start it in Chennai, and he had initially difficulties when he gave the report and interpretation which was not accepted. But slowly, and then we brought people from USA, gave some training to a lot of people from Bombay and all. And there is no technician, nothing there, so you have to create all the infrastructure. Now it is full well established. So it is there, people won't initially accept anything new. Right now we are currently doing a project like when you do the cardiac CABG surgery, the doctors make mistakes, technical error, and we have developed an ultrasound which before closing the chest they can find out whether the surgery was technically successful. And which hospital in Bangalore? Narayana Health. What is his name? Shetty. No, we are making only 100 crores now. He himself taking all the 100 crores. So we are not able to supply to other hospitals. But we have an alternative program which is little bit difficult, and we both are now involved in finding out lot of information during this surgery, which surgeons themselves are not knowing it. In fact, they are asking, you are giving a number here. What does it mean? I mean, we give a number about the heart situation. Okay, it is this. So now we have done lot of studies, research, and come out with a clean pamphlet which is just going to be printed next week. Hopefully that if it accepts, it will solve the... See, the point is the patient who receives surgery should get a good quality surgery. That's the only objective. Of course, we make some money, but it's not the primary objective. Because our company itself, we have always did things which is first time in India, and our people leave and start their own companies. And even 6 months ago, our R&D man has left, started his own company. we encourage them.
That's all. The world is like that. Happy.
So the research, now India is picking up, research is picking up, but
Funding.
I will give you this was in 1980 or 81. Radiologist, oncologist, no radiologist. At the time, not many oncology. I don't think there was not oncology. No, they wanted, in a conference, they wanted me to sponsor a doctor from Philadelphia. I asked him, is he the number one in the world? He said, no, if you want, the number one person is Dr. Madam Chu, who is the inventor of linear accelerator. And accidentally we found out she was involved in surgery to Anna. I said, if you number, and it's very difficult to get appointment with her. Somehow I got appointment, I brought her to Chennai, and she sat through the lecture. She's not comfortable. The way we are presenting things. So she said, I will give lecture and then I'll go and take rest. So the standard was so poor at the time. But somehow, see, what I say is, if you want to do something, do the number one. We compromise with number two, number three. So then, the government of Tamil Nadu came to know about that, and then it helped to establish oncology, radiation oncology. So sometimes we don't know, we start with one and we end up with another.
Okay. So great, sir. I'm so happy. Initially, I know how much suffering you had, but you are able to succeed all the things. That is what. See, we also definitely follow your guidelines, and we will try to approach. Good scientific thing is there in Chennai, Bangalore, and other places. So, what is your opinion about the R&D department, sir?
I think it's a fantastic initiative to create a treatment like protocol like this. So it will solve many problems, many people's fear in approaching socially, and generally men will have some kind of insecurities. This insecurities and all will be the persons who attend the treatment will get definitely benefited. I felt this is a very good initiative. Undergoing those people more. What I want to say is, like, in a natural way, we are all gifted in some kind of voice, but that gifted voice itself is a problem for us. That will be a great mess. So now, the way, sir, I sincerely thank you for the you approach this kind of solution and formulating a protocol for this. So towards R&D, I just need some more time to analyze what the product, which can help the doctors in a better way to solve the device protocol, which is based on the device, biomedical device. So we will need some more time to analyze and give you the proper output. What can be done analyzing this low pitch and high pitch voices. So I thank you so much for letting me know this kind of treatment protocol. Thank you, sir.
Okay. Thank you, the researcher, Mr. Sudaresan. We'll try to give what are the required matter or follow that we want to go ahead. This is what our researcher, Mr. Senthil Kumar, used to tell. This is a never-ending process. So we'll go ahead. I hope we'll be able to succeed. Thank you very much, sir. Great. Thank you. Thank you.